The topic of the research I did work on with a couple of colleagues was on detecting serious disc bulge in the axial view of an MRI image of a lumbar spine. So for this, we used convolutional neural network, and we also used image explainer, line precisely, which is the local one. Yeah, so okay, so the presentation would follow this format. It's a very short one, not really long. So I'll introduce the research. I'll talk about the methodology. I'm also going to give an overview of the model architecture used in this work. Yeah, we'll talk about the model results, and we're just going to conclude briefly. Yeah, so lower back pain, which is as a result of serious disc bulge, is a prevalent global medical condition. Research says that it affects up to 80% of people at least once in their lifetime. And this disc bulge is quite prevalent, and it can vary from no to very serious levels of clinical significance. Clinical investigation shows that many lower back pain patients contend with serious disc bulge, so hence prompting or requiring accurate diagnosis. So initially, traditional ways of doing this was visual assessment method. So where, for example, you were to complain of a serious back pain, you would get booked for an appointment with the NHS, after which they could recommend you going for MRIs. So you get an MRI scan, then you then have to book an appointment to see a radiologist to interpret or diagnose the MRI. So and this is quite effort expensive, right? So because with the limited number of radiologists we have, and also with the delays, especially with the NHS, if you're familiar with the UK, this is also time consuming as well. So one of the idea of this project or this research work was to see how we could aid clinicians in terms of diagnosing lumbar spine, especially in terms of serious disc bulge. So yeah, I mean, AI has come to stay. So we have found a way, or we are looking for ways to use it to improve our lives. So which is what we're trying to do. An AI system that is more accurate in detecting the presence of serious disc bulge. So this is the image of the lumbar spine, right? So for this research work, we considered the last three discs, which is in medical term, the L3, L4, L4, L5, and the L5S1, right? So this is the disc, and so you can see a normal disc, and you can see one that has bulged out of its position, thereby compressing the nerve. So this, I mean, you could say it could be quite serious depending on how bulging the disc can be. So yeah, just a brief explanation of what this bulge is, and so it occurs when the inner component of the IVD, which is the intervertebral disc, protrudes from its outer wall and progresses over time. So it can lead to additional disc degeneration problem. So the first stage is always the bulging disc, right? So this bulging disc can then go on to cause serious problems such as disc herniation. So which is when it has completely protruded out and it's causing serious pain, or spinal stenosis, or scatia. Yeah, so serious disc bulge on the disc can put pressure on the surrounding nerve roots, causing pain to travel down the back and other parts of the body. Serious disc bulge conditions are diffuse. So Yeah, so we looked at certain conditions in the MRI image, and with the help of our NHS doctor, to diagnose what we call serious and what we would consider serious and what we would consider not so serious. So cases like diffuse disc bulge compressing the thecal sacs and exiting the canals, this protrusion or herniation compressing the thecal sac and narrowing of the left neural foramen. So these are some of the conditions we classified as a serious case of disc bulge. Right, so to the methodology, so that's just an image showing a slice of what's the MRI image of the discs we took. So for the methodology, we started off with data collection. So the data was supplied by a researcher called Soldman. He gathered 515 patients with their last three dates, the L3, L4, L5, L4, L5, then L5, S1. So that was the data that was then used. So we then analyzed this data for cases of serious disc bulge and no serious disc bulge, and of course we did keep some data for our validations. So in terms of the analysis, we did some labeling. So we went through the MRI images to label them. Then for the we sorry to label them. So after which we then did our data count. So the total images summed up to around 1,470 after our analysis. Then we then did what we call data augmentation, which is a way of generating fake data from an original data set. Right, this was done to sort of like increase the sample size so that our model can learn better. So for our no serious disc bulge, we had an augmentation factor of 1.33. So we generated approximately 1,426 images. While for the serious disc bulge, we didn't have too many conditions to that. So we had to generate almost 2,000 plus. So it brought the total sample size to 5,000 with 2,500 for no serious bulge and 2,500 for serious bulge. So after that, we worked on the model implementation. So we built our CNN from scratch with all the different layers. Yeah, after that, we then did some hyperparameter tuning, which was a way to improve the model efficiency. So we did tune things like the hidden layer, the regularization and the learning rates and some other parameters as well. Yeah, so after that, we evaluated the model on certain parameters like the accuracy, the precision, and the recall. So because it's a medical study, accuracy is quite important to this study as well as the recall. So recall is the ratio of false negative in the study, which is quite important because for a medical diagnosis, we do not want to have cases of false negative. So false positives are always better because, and then we can then diagnose for them that yeah, it's not a serious case, but missing false negatives is quite detrimental. So we did base the evaluation on the recall, the precision as well as the accuracy. Then we also further implemented explainable AI. So the concept of explainable AI is to explain how the model arrives at its decision in terms of its prediction. So which is something we're trying to adopt in the AI space. So it's not just enough to build models, but it's also good to explain how these models arrive at their predictions. Then we also built a front end where we deployed the model. So it has an interface where you could upload MRI and the model will make predictions on the image. So this is the model architecture. So we have the convolutional layers. So to detect various features like edges, the texture, and the pattern. Also, we had like 12 layers comprising of the conv to the mask pooling and the dropout layers. We had a widening depth from 64 to 500 as well, which allows the model to learn and extract increasingly complex feature from the image. We had a flattening layer, which is used to flatten the inputs fed into the fully connected layer. So we had a connected layer which trains the extracted features and does the classification decisions, and we have the output layer for our binary classification. Softmax was used as our activation function to ensure that the output from the network is a probability distribution across the class. So for model evaluation, we had an overall accuracy of 89%, a real call score of 89%, and a precision and F1 score of 89% as well. So that's the confusion matrix. And you can see that we did have quite a decent number of predicted that were actual for the nil and also for the serious. So in terms of explainable AI, so we did use LIME, local interpretable model agnostic explanations. So basically what we did was to pass the trained data and the outputs into LIME, and it then provided explanations as to which area were contributing most to the model's decision. So the image so you can see the original image as it is, and this is the one we had passed into LIME, and I'm also making explanation as to which areas were contributing to the decision. So in conclusion, the model achieved impressive performance with accuracy, average recall, average precision, and F1 score all being 89%, which is quite high. But of course, in the medical space, there's always room for improvement as well. So most significantly, this research has also addressed a crucial aspect that's been overlooked in AI-enabled diagnosis of serious disc bulge. So we introduced the concept of explainable AI into our study to gain trust, because it's not okay to build a model that has a good score and does prediction, but if it's to be adopted in the medical space, then we need explanations on how the model arrives at this decision. So yeah, for improvement, so more validation is needed on diverse image data set before a full clinical deployment can be made. And the continuous improvement and feedback from medical experts are also very important.